The next COVID booster is expected to be available in the U.S. as early as next week. It'll provide protection from the current variants. First, though, the FDA is expected to authorize or approve the shots. Then the CDC would need to provide a recommendation on who would be eligible for the shots. A CDC director would then sign off, and then that's when the shots would become available. But all new at 6:30, we look inside the numbers on the amount of COVID cases in Arizona from ABC15 data analyst Garrett Archer.
The Arizona Department of Health reported just under 2,500 new COVID-19 cases added between August 30th and September 6th. To give you an idea of what that means, that's less than 0.1% of the total 2.5 million cases recorded. So 2 new deaths were also recorded. That's less than 0.01% of the 33,731 total COVID-19 deaths. But we are long past the time when cases are a useful indicator of COVID-19 spread. New variants are milder and at-home testing is widespread. But the virus is still around and it appears to be surging in some places. For example, 38% of wastewater sites in the past 15 days detected double to 10 times the viral levels of shed in their testing. A quarter of the sites had over 10 times the amount detected. The sites with the highest levels are in Yuma, which indicates a growing COVID-19 cluster is likely present in that county. The state is also seeing a slight rise in COVID-19 hospitalizations, 228 reported last week. Looking at the data from this whole last year, we are nearing a point when COVID-19 hospitalizations may have a seasonal spike, which will likely peak in December. The good news is weekly COVID-19 deaths continue to trend down. In fact, they have been in the single digits since early July, which has brought the 4-week average down to single digits as well. The hope is even with the seasonal spike, this trend will continue. With a look inside the numbers, I'm Garrett Archer, ABC 15 Arizona.